Welcome to NSP 222, Study Session 16, Nursing Management of Patients with Selected Cancer. Introduction. Comprehensive study of cancer, especially the types, causes, and diagnosis has been given in the last 3 study sessions. From your study, you should understand that the different cancer types require different management on your part as a nurse. Therefore, in this study session, some selected cancer type and specific nursing management for each cancer type will be discussed. Learning outcomes. Explain nursing. Management of patients with breast cancer. Highlight nursing. Management of patients with leukemia. Identify nursing management of patients with lymphoma. Describe nursing care of patients with colon cancer. Analyze quality of life issues. Nursing management of patients with breast cancer. A cancer diagnosis of any type is likely to create a whirlwind of emotions for the patient: fear, shock, anger, anxiety, denial, and depression. Many women are surprised by the diagnosis because they feel healthy. Patients with breast cancer, unlike those with many other cancers, rarely have unpleasant signs and symptoms at the time of diagnosis. Caroline Weaver, 2009. Therefore, the nurse should do the following: assess and be sensitive to patients' emotional health. Assess her learning needs and readiness to learn. Provide all information she and her family need to know about breast cancer. Encourage her to verbalize her fears and concerns. Educate her on all the treatment options and guide her to make informed choice. With the permission of the patient, allow a significant other to be present at the time of teaching. Specific nursing management, preoperatively. Some specific nursing management are required for a breast cancer patient before surgery. Some of these are given. Provide the woman with sufficient information to ensure informed consent. During this period, the woman may exhibit signs of distress or tension, such as tachycardia, increased muscle tension, sleep disturbances, and restlessness. Therefore, the nurse should watch for these signs and manage promptly. Describe surgical procedures to alleviate fear. The nurse should explain the recovery period from the time of surgery to the time of discharge. Teach her to follow all preoperative instructions. Allow her to verbalize her concern. Allow her significant others and husband to participate in her care. Postoperative care. After the surgery, you as a nurse need to monitor vital signs half-hourly for the first 24 hours. General assessment should be assessed for pain, bleeding, hematoma, and wound infection. Pain management. There are several different types of pain that patients may experience after breast cancer treatment. They include post-mastectomy pain, bone pain, neurologic pain. The nurse should administer prescribed analgesics. Pain should be reassessed when she asks for analgesic and at 30 to 60 minutes after medication administration. Restoration of arm function. The woman should be placed in semi-fowler's position with the arm on the affected side elevated on pillows. Flexion and extension of the arm should be encouraged. Nutritional management. It is possible for the woman to refuse food because of nausea and vomiting. Therefore, the nurse should encourage her to eat and serve only the food that the patient wants to eat, and little at a time should be served. Also, fluids should be encouraged so as to keep the woman well hydrated. Care of drainage tube. If she has a drain on, teach her how to milk or straight cloths through the drainage tubing to maintain patency, and how to empty and measure fluid from the drainage device. Lymphedema. According to McKenzie, 2012, approximately 15% to 28% of breast cancer patients will experience some degree of lymphedema. Therefore, measures to prevent or reduce it should be taught to the woman, such as exercises of the affected arm, protecting it from trauma, avoidance of wearing elastic bandages in early post-operative period, and good nutrition. Management of adverse effects of chemotherapy. This includes nausea, vomiting, and alopecia, etc. McKenzie, 2012, stated that about 90% of patients that are receiving chemotherapy will experience nausea and vomiting, so alternative regimen should be given to the woman. Prophylactically, as prescribed by the doctor, dexamethasone and serotonin antagonists are commonly used. Other measures include acupuncture, teaching patients relaxation technique, preparing for prosthesis. Women who have a mastectomy without breast reconstruction are usually fitted for a breast prosthesis about 6 weeks after surgery, as long as their wounds are healing well and post-operative edema has resolved. Weaver, 2009. Hence, the woman should be informed about it and guided toward choosing the one that is suitable for her. Manage the woman for complications of chemotherapy and radiation therapy, such as fatigue, hot flashes, osteoporosis, cognitive dysfunction, or chemobrain. Follow-up. Give appropriate information as regards follow-up of patient care and its necessity. Psychological management. Assist her to develop a positive but realistic attitude. Help her identify sources of support and strength to her, such as a partner, family, and spiritual practices. Encourage her to verbalize her anger and fears about her diagnosis and the impact it will have in her life and her family. Promote open communication of thoughts and feelings between the parent and her family. The nurse should provide accurate and complete answers to questions about her disease, treatment options, reproductive or lactation issues, if appropriate. Offer information about community resources close to the patient. Introduce patients to other women with the same condition who are coping with it. Attend to her sexuality concerns. Nursing management of patients with leukemia. The nursing role during acute phases of leukemia is extremely challenging because the patient has many physical and psychological needs. As with other forms of cancer, the diagnosis of leukemia can evoke great fear and be equated with death. It may be viewed as hopeful, horrible disease with many painful and undesirable consequences. The treatment and prognosis of each patient with leukemia is driven by many factors, such as age, immunologic cell surface markers, and cytogenetic. Patients are not the same. Therefore, it is important that we have understanding of the patient's type of leukemia, the prognosis, the treatment plan, and the goals. The nurses should help family in adjusting to the stress of this abrupt onset of the serious illness, e.g., dependence, withdrawal, changes in role responsibilities, and alterations in body image, and losses imposed by the sick role. Important nursing interventions include maximizing patients' physical functioning, providing hope that acute symptoms of treatment are usually temporary, and encouraging patients to discuss their quality of life issues. Nurses should remain an important advocate in helping the patient and family understand the complexities of treatment decisions and manage the side effects and toxicities. Ongoing care of patients with leukemia is necessary to monitor for signs and symptoms of disease, control, or relapse. For patients requiring long-term or maintenance chemotherapy, the fatigue of long-term chronic disease management can become arduous and discouraging. Therefore, it is important for the nurses to teach patients and caregivers to understand the importance of continued diligence in disease management and the need for follow-up care. They must be taught about the drugs, self-care measures, and when to seek medical attention. Nursing management of patients with lymphoma. Most of the care for patients with Hodgkin's disease or Non-Hodgkins lymphoma is performed in the outpatient setting, unless complications occur, example, infection, respiratory compromise due to mediastinal mass. For patients who require treatment, chemotherapy and radiation therapy are most commonly used. Chemotherapy causes systemic side effects, example, myelosuppression, nausea, hair loss, risk for infection, whereas the side effects from radiation therapy are specific to the area being irradiated. For example, patients receiving abdominal radiation therapy may experience nausea and diarrhea, but not hair loss. Regardless of the type of treatment, all patients may experience fatigue. The risk of infection is significant for these patients, not only from treatment-related myelosuppression, but also from the defective immune response that results from the disease itself. Patients need to be taught to minimize the risks for infection, to recognize signs of possible infection, and to contact the healthcare professional should such signs develop. Survivors should be screened regularly for the development of second malignancies because as survival rates increase, the incidence of second malignancies also increase. Patient education. Select a treatment plan with the patient. Avoid crowds. Avoid infected visitors, particularly children with colds. Wash the hands frequently. When an infection occurs, report it to a physician immediately. Avoid direct contact with pets to limit the risk of infections from licks, scratches, or bites. Maintain a high-calorie and high-protein diet. Make seeds of grapefruit juice, orange juice, or ginger if nausea persists. Drink at least 2 liters of fluid a day, unless on fluid restriction. Perform frequent mouth care with a soft toothbrush and avoid commercial mouthwashes. Manage pancytopenia and other side effects of therapy. Supporting patients through the immunosuppressive state. Treatment of skin in the radiation field. Assist patients to deal with all the physical, psychological, social, and spiritual consequences of disease. Evaluate patients for long-term effects of therapy. Differences between Hodgkins and non-Hodgkins lymphoma. Some of the differences between Hodgkins and non-Hodgkins lymphoma are given in the table below. Hodgkin: 1. Increasing age. 2. Male-female 1.7:1. 3. Stage 3 and 4. 4. 15% B. 5. Random. 6. Leukemia common. 7. 80% nodal. 8. 20% mediastinal. 9. 70% marrow. Non-Hodgkin: 1. Bimodal age. 2. Male-female 5:1. 3. Stage 1 and 2. 4. 25 to 40% B. 5. Centripetal. 6. Leukemia rare. 7. 95% nodal. 8. 50% mediastinal. 9. 10% marrow. Quality of life issues. Quality of life (QOL) is a broad term that reflects a patient's overall sense of well-being and satisfaction with living. Rovka and Padilla, 2007. No doubt about it, a leukemia or lymphoma diagnosis will change the life of the patient. The nurse needs to assist in teaching the patient about leukemia or lymphoma remission, relapse, and life after treatment. Living with leukemia or lymphoma is a life-changing experience on many levels. The patient's perspective may change, and he thinks of his life in new ways. For many people, this experience serves as an opportunity to re-evaluate their lifestyle and make positive changes to improve their overall physical, mental, and emotional health. Making thoughtful changes helps people living with cancer reduce their stress levels, gain confidence, discover new interests, and find greater meaning in life. Moreover, setting realistic goals and working to achieve them often helps people feel more in control of their future amidst the uncertainty of a cancer diagnosis. The standard 4-item set of healthy-based core questions CDC-HRQOL to 4 as being in the state-based behavioral risk factor surveillance system (PRFSS) since 1993. Since 2000, the CDC HRQOL to 4 has been in the National Health and Nutrition Examination Survey (NHANES) for persons aged 12 and older. Quality of life issues. Since 2003, the CDC HRQOL to 4 has been in the Medicare Health Outcome Survey (HOHealth). Standard activity limitation and LD days symptoms modules have also been available since January 1995. When used together, These measures comprise the full CDC HRQ-OL-14 measure. Nursing care of patients with colon cancer. Colon cancer patients also require both general and specific nursing management. These are explained below. The general nursing management, subjective data, important health information, past health history, previous breast and cervical cancer, familial polyposis, villus adenoma, adenomatous polyps, inflammatory bowel disease. Medications. Use of any medications affecting bowel functions, e.g., cathartics, antidiarrheal drugs. Objective data. General, pallor, cachexia, lymphadenoma type 2, lymphadenopathy, later signs, gastrointestinal, palpable abdominal mass, distension, ascites, and hepatomegaly, liver metastasis. Possible findings: anemia, Grahak positive stools, palpable mass on digital rectal examination, positive sigmoidoscopy, colonoscopy, barium enema or CT scan, positive biopsy. Pre-operative care. Preparing the patient physically for surgery. Providing information about post-operative care, including stomach care if a colostomy is to be created. Supporting the patient and family emotionally. The patient will likely need intense emotional support to cope with their prognosis and the radical change in body appearance and function. The patient should be taught side-to-side positioning. The nurse should teach and assist the patient in proper positioning for taking a seat bait. Post-operative care. Pain management. The nurse also monitors the patient for complications such as leakage from the site of the anastomosis, prolapse of the stomach, and pulmonary complications associated with abdominal surgery. The nurse assesses the abdomen for returning peristalsis and assesses the initial stool characteristics. Help patients with a colostomy out of bed on the first post-operative day and encourage them to begin participating in managing the colostomy. Other nursing care. Other nursing care includes: provide comfort measures and reassurance for patients undergoing radiation therapy. Prepare the patients for the adverse effects of chemotherapy and take steps to minimize this effect. Use strict aseptic technique when caring for IV catheters. Have the patient wash his hands before and after meals and after going to the bathroom. Listen to the patient's fears and concerns. Stay with him during periods of severe stress and anxiety. quality of life issues. Quality of life is a broad term that reflects a patient's overall sense of well-being and satisfaction with living. From the time of diagnosis, the quality of life of every person with cancer is affected in some way. They may be affected socially, psychologically, and physically. Rofka, Padilla, 2007. Physical needs: weight loss, change in taste and decreased appetite, increased bowel movement resulting in diarrhea or constipation. Odors and flators may arise from stomach, facial, or urinary fistulae. Reduced sexual interest and sexual dysfunction, erectile dysfunction and ejaculation dysfunction. Psychological needs: anxiety and depression, body image, fertility. Social needs: restriction from social activities. Information needs: family history. Summary: in this study session, you have learned that 1. Patients with breast cancer, unlike those with many other cancers, rarely have unpleasant signs and symptoms at the time of diagnosis. Caroline Weaver, 2009. Therefore, the nurse should do the following: assess and be sensitive to patients' emotional health. Assess her learning needs and readiness to learn. Provide all information she and her family need to know about breast cancer. 2. The nursing role during acute phases of leukemia is extremely challenging because the patient has many physical and psychological needs. As with other forms of cancer, D as hopeful, horrible disease with many painful and undesirable consequences. 3. Most of the care for patients with Hodgkin's disease or Non-Hodgkins lymphoma is performed in the outpatient setting, unless complications occur. Example: infection, respiratory compromise due to mediastinal mass. For patients who require treatment, chemotherapy and radiation therapy are most commonly used. End of study session 16 and end of NSG 222. Thanks for listening.